Hi, I'm Sandy Bartlett, the SHIP coordinator for the Southwestern Vermont Council on Aging. That includes Bennington and Rutland.
Hi, I'm Amy St. Ange. I'm the health coordinator at Bennington Project Independence, the adult day service in Bennington.
Hi, I'm Kathy Cardiff. I'm the SASH supervisor for the communities of Arlington, Bennington, Shasberry, North Bennington, and Manchester.
I'm Kelly, and I'm the Regional Southern Coordinator for Outreach and Volunteers. And today I've brought together the SHIP Coordinator for Southern Vermont, Bennington Project Independence Adult Day Center, and the SASH Program Coordinator here to talk about healthcare access in Southern Vermont. Sandy, could you tell us a little bit about the SHIP program here in Southern Vermont?
Well, Vermont SHIP is a statewide program that provides counseling for people who are coming onto Medicare, who are approaching Medicare eligibility, and also for people with disabilities who are now becoming eligible for Medicare. And our mission is to provide information, unbiased counseling information on how to access a supplemental insurance for Medicare. We also counsel the families or caregivers if people are not cannot come into the office or talk on the phone. We definitely counsel the families. It can be complicated. I hear that all the time. This is very complicated, and it can be very confusing. The counseling assistance, I try to give them information on Part A, Part B. Part D is our prescription program. So there's a whole gamut of things that you have to learn when you're going on to Medicare. And we try to reassure people they will get through it, and we will help them make out forms, or we certainly can take care of their Part D prescription program. We gather some information and we get their prescription information, and we can run that through different companies that Vermont deals with, and we will find them the perfect prescription program for them. Not always, but if not, we can fix it, and we can even enroll them, so they don't really have to do much of anything except to give us the information on the Part D program. Also, we talk about supplements for the 20% that Part A and B doesn't cover. So we help them find companies. We do comparisons with companies. We give them even the telephone numbers of how to access them. But our mission is really to empower them to be able to go out and get this information for themselves, or the companies to enroll in. We'll also help them. If they come back and say, well, we contacted this one, that one, or whatever, and we're confused, and so we'll sit down again and help them. It can be a process. It is a process. And our seniors, you know, and I am one of those, get to a certain age, we don't want all this complicated stuff. So we try to make it simple for them.
Yes, thank you, Sandy, for telling us a little bit about the SHIP program. Yes, my experience through the Cove SMP program has been that there's a lot of questions with Part A, Part B, Part C, Part D. You've mentioned a Part F, a Part K, and all sorts of add-ons and supplements and gaps and advantages, and weeding your way through that process can be very, very, very complicated.
Yes, it is.
And I know for seniors out there who primarily may already have Parts A and Part B, but each year there's a new open enrollment for Part D if you want to change. And one of the things that they have to be very careful with are the formularies and making sure that your prescriptions are on those formularies. Here's to know about this process is while you have SHIP and you have your Council on Aging to support you in your enrollments and in your choices for health care, you're also going to be solicited during those open enrollment times tremendously through telemarketing, through junk mail, through any avenue that companies can possibly access you through, your email, just so many avenues that they can find you, that it will become difficult to determine what companies might be the most appropriate and what companies are actually the scam. And do you have any advice out there, or any advice for seniors out there who may be experiencing just an overload of information and they don't know where to start, and they've called the senior helpline and they've spoken to you a number of times, I'm sure, and they just still don't know what to do in terms of enrolling for their health care?
Well, first of all, if it's a Part D prescription program, there's not as much advertising for the Part D. It's mostly for the Advantage plans versus Medigap policies. So they should come back to us. If it's a face-to-face, if they need us to sit down with them, we do that. We explain that to them. The Part D program, however, the formularies that you're talking about, every company has a formulary, and they may cover one drug this year and then take it off next year, and they won't cover that particular drug. That's where we come in. That's where we can, SHIP can handle that whole process for them. And that is one of our primary functions, is to take their medications, find them a program that covers all of their meds, that all of their meds are on their program, and enroll them in that.
Now, in order to access the SHIP program, you'll have to go through the Council on Aging. Should they contact the senior helpline to access you directly? Do you have a direct line? Should they visit the Council on Aging here on North Street? How would you best direct them to be able to contact you?
They may call the senior helpline. They can call my local number, or they can come into the office, either the Rutland Council on Aging office or the Bennington office, and we will help them.
Wonderful. And can you maybe give us a little snapshot of the most common questions that you're seeing as the SHIP coordinator here? And for those of you who might be confused, SHIP stands for the State Health Insurance Program, and there's a SHIP coordinator in every state throughout the country.
The most common question is, do I have to have a supplement? Do I need a supplement when they come on to Medicare? That supplement will cover 20% of their costs. A and B will cover the 80%. We need to counsel them to find them. Maybe they cannot afford. They're worried about the cost of the program. So we try to find them a supplement that will meet their financial needs. Part D would probably be the second most common question I get. Well, what do I do? Do I need a Part D? And how much am I going to have to pay for it? And people are worried, very worried today about the cost of the programs.
Absolutely. Well, thanks for giving us a little snippet of how the SHIP program works.
You're welcome.
Now that I have health insurance, if I'm a hypothetical 65-year-old senior, and I would like to stay in my home, but I'm facing some disabilities, or my family has to care for me because I have some disabilities, I might think about going to an adult day center. And here in Vermont, or in Bennington, we have Bennington Project Independence. Bennington Project Independence has been around for
Many years, actually. We've been in existence since 1979.
Oh, wow. So they've got a very, very long standing reputation here in the community. And I personally have been to BPI, and it's a beautiful, beautiful facility. If you ever get a chance, just go up and take a look at their new renovated barn and building. Please do so. But we brought Amy here today from BPI to talk to us a little bit about healthcare access that occurs through the Adult Day Center program. Could you talk to us a little bit about that today, Amy?
Sure. For those of you that don't know, we're an adult day service, and what that means is we take care of people 18 and older with disabilities or frail elders. So basically you have to be 18 years old. And to access our health care at BPI is very simple. We have a phone number, local, 447-8291, and you can talk to an enrollment coordinator. And if you're uncomfortable talking to them on the phone and giving some intake information, you may choose to ask for a tour or a complimentary visit, half or a full day, to see if BPI would be something that would meet your needs. We take care of folks during the day. Our operational hours are 7 a.m. to 6 p.m. Monday through Friday. We do have transportation in the Bennington area. We contract through Green Mountain Network for people that might live in the outer areas, in the Northshire area, Manchester, Dorset, Arlington. So we're trying to take care of all of our folks that might need help in the Bennington County. So transportation is available. Once you sit down with our enrollment coordinator, you choose to enroll in our program. It's very flexible. Our care is what we call patient-centered care, and that means that our communication and our care matches what the client needs. It's individualized. It's not you need A, B, and C in your care, and this is your care plan. Everybody's an individual at BPI. Many of our folks have dementia. Alzheimer's dementia is the most common form of dementia, and it accounts for 60 to 80% of dementia. And dementia is a growing problem in America. It's an epidemic. Folks are living longer. Once you reach 65, 1 in 8 persons have Alzheimer's disease, and once you reach 85, you see people, about half of the people, 85 and older, have Alzheimer's. And we can take care of people still living in their homes. Maybe they have a caregiver still working. Maybe their son or daughter takes care of them, but they still need to work. So Bennington Project Independence is a service open during the day in which we could provide that care for them during the day, during the working hours. We're a sandwich generation. In fact, I myself, many of you yourselves have probably experienced that you're working, you're taking care of your own family, and you're taking care of your elderly parent. And BPI is a wonderful place for the elderly parent to come for the care that they need during the day. They're still living at home. They still have that wonderful ability to be in their own home and yet have the care. And family caregivers have the respite ability. And respite means basically rest for that caregiver. Caregiving is very challenging. It is very tiring and overwhelming for especially an elderly person taking care of their spouse. So we share the care basically at BPI. So that's what we do. And we're talking about seniors here today, but we do take care of folks with disabilities over the age of 18 as well.
That's wonderful. So I have my health insurance. I now want to go to the adult day service. How do I begin to access those services? By calling one of your enrollment specialists?
Yes.
Can I just show up someday and, you know, see if I like what goes on for the afternoon? Can I visit for an afternoon? Can I just come for some certain activities? What are my choices in actually accessing the services that BPI would give me?
It's pretty flexible. Getting a person through the doors is often the hardest part because people are fearful of coming to an adult day service. What is it? They don't know. They believe that it's a nursing home environment or an institution. And once that person does go through the doors at BPI, they do realize this is my home away from home. So we do encourage someone to call for a tour. Get them through the doors and have them see for themselves that it is a nice environment, a warm, caring environment in which they could have activities throughout the day. They'll have a homemade lunch, snack. They have the supervision and safety that they need. They have personal care and they have health care. I'm a nurse, I'm an RN, and we have 2 LPNs on staff as well. LNAs, so their healthcare needs are met and their social needs are met. Social need is huge. People, elderly especially, they become depressed. They're socially isolated in their homes. And just getting out to a social environment makes them feel so much better. They have a purpose for their day. Their depression lessens, their mobility increases, so it makes my job as a nurse very easy because just the nature of the business helps people heal and get better.
Oh, that's wonderful.
So I suggest making an appointment for a tour and sitting down with our enrollment coordinator and enrolling. I think that it's important for all seniors to have a social outlet and a good, safe environment for the day.
Well, now say I didn't want to come every single day. I just wanted to come maybe Friday afternoons. Is that sort of service available and flexible for seniors that they could just go on Monday, Wednesday, Friday afternoons, or one day of the week, or maybe for you know, a 2-week stay while their family's away on vacation, or in terms of that type of flexibility, is it?
Yes.
Is it accessible?
Absolutely. We work very hard to meet the needs of that individual. If they only need or want to attend a half day, one time a week, or if they want to participate in a whole week, you know, Monday through Friday. It's a little bit more difficult for people living on the outskirts of the Bennington area. Because we couldn't offer them a half day or, you know, a partial day using the Green Mountain transportation system. You know, generally it's one run out there and one run back. So it's a little bit more difficult in that aspect, but we still certainly could coordinate and be flexible with what, you know, a person might need. So nothing is black and white. It's, you know, it's flexible, and like I said earlier, it's about patient-centered care.
I love to hear that. And for those of you who may not have experienced it yet, COVE, the SMP program, the Senior Medicare Patrol program, was already out there once last August with our Savvy Seniors, who you will see later on in one of our programs. And we are planning on being back out there in April with our program, When Healing Hands Harm. So now, in terms of healthcare, Amy, you're a nurse, you have your LNAs, you have your LPNs. I'm a senior who has a cardiac condition, and my doctor wants my oxygen and my blood pressure monitored for the day, and I've got scheduled meds I have to take at 1 and 4, and those kinds of the nuances of our health care that sometimes we will forget about, or we might get busy in a card game at BPI and not remember that, oh, it was time for my 2 o'clocks or something like that. Do you offer services such as that to help a senior stay in communication with both their actual healthcare providers, their doctors, as well as making sure that they stay on track with their medicines and checking their blood pressures and things like that.
Yes, and that is a big role of mine. We do administration of medications, oral, injectable. I monitor people's health. You mentioned cardiac. Diabetes is also very big. If somebody needs to have their blood sugar checked before lunch and have insulin, we do have that. Opportunity in which they could meet with me, and any health care that one might need and is found in a nursing home, primarily we can do that as well. The skilled health care needs, we can take care of wounds, ostomies, if someone has an indwelling catheter, any type of skilled nursing need, I can help them out. We do have a private treatment room in which we have a bed and the medical equipment that we need to monitor someone's health care very privately.
So now, posing the scenario that I'm a cardiac patient again, and yesterday afternoon after lunch, I suddenly had a little bit of a flutter in my heart, or I felt my blood pressure drop drastically. Will you communicate with their doctor that, well, yesterday Mrs. Smith or Mr. Jones seemed to have a little bit of a spell in the afternoon. I kept an eye on them. We checked, we followed up, but I just wanted to make sure that you guys, the doctor, were aware, or whoever that next level of care might be.
Yes, I do have open communication with a variety of the physicians in the community. If you access BPI, you don't have to change doctors. You have your own doctor, and I do, communicate with them directly with any changes in health, any concerns that I might have with failing health, or my role is to prevent hospitalization, so it's very important for me to see things and assess them, and hopefully problem solve before the hospitalization has to occur. So I am a liaison with other providers in the community, family caregivers, doctors, physical therapists, so that communication line is always open.
So if I'm a regular visitor at BPI and I have every Tuesday physical therapy for my legs for circulation, can my physical therapist come to BPI?
Yes, just as long as the funding, perhaps maybe Medicaid is taking care of your funding for the day, as long as Medicaid isn't providing that physical therapist as well, because the two can't coincide at the same time, two services. But generally speaking, if someone has had a surgery and they have outpatient therapy, it's usually Medicare that is funding that physical therapy, so it's generally not a problem.
That's wonderful to hear. Well, thanks for telling us about some of the services available at BPI. I look forward to coming back in a few months and seeing you. And for those of you out there, you can access their contact information at the end of this video. And Miss Kathy Cardiff, hello. Thank you for coming today. So we've heard about health insurance, and I've got my health insurance now, and I want to go to my adult day service for the day, but I still live in Brookside or Williamsack Apartments, or even just at home. And there is a new program in Vermont called the SASH program. And Kathy, could you tell us a little bit about what the SASH program is?
Okay, Kelly. Like you said, SASH stands for Support and Services at Home, and it's part of the Blueprint for Health, which is Vermont's statewide health reform initiative. So it began in a congregate housing site in Burlington, and they started this pilot project to see if they could reduce ER visits, falls, hospitalizations by putting this program in place. And they ran it for a couple of years and had some really great results. So decided to see if they could replicate those results statewide. So Cathedral Square, which started this program in Burlington, contacted different what's called DROs, which is Designated Regional Housing Organizations around the state. And our DRO is Shires Housing, which was formerly named Regional Affordable Housing. And
So
it was
RAC, what
RAC,
was
right.
formerly known as?
Right. And so it was brought to, we started probably about 2 years ago, and we initially started in congregate housing, which for RAC, for Shires Housing, is Cora B. Whitney up on Gage Street, and they collaborated with Bennington Housing Authority in their elder sites, which are Walloomsac and Brookside apartments. But now we enroll folks from the community as well. So you don't have to live in a congregate housing site in order to participate in SASH. So what SASH does is we work with seniors and with folks that are younger that may have disabilities. We help them to access the care and support that they need to stay healthy and to stay independent and safe in their homes. Oftentimes, seniors get overwhelmed by healthcare options and services that are out there, navigating the whole healthcare system, and finding the available resources that there are. You know, something happens and they don't know where to go. I hear it a lot. I just don't know, you know, where to find the answers. And that's one of the things that SASH does for us. We're designed to provide, as Amy said, a person-centered program. So it's what you need to keep you safe and to keep you healthy at home, and to access the services that you need, so that to keep people as independent as long as possible. That's what our goal is. And so far, we've found that statewide, we're reducing falls and reducing ER visits and
that's wonderful.
hospitalization. The numbers are good, so yeah, we're happy about that.
That's wonderful. And so how SASH is in all of the housing developments throughout Bennington?
Not all of the congregate housing, but we are in all of the senior ones.
Okay,
we
wonderful.
Have, we have what we call hubs, which are where our programming happens, because we do a lot of programming around the SASH program. So we have a hub in Walloomsac Apartments, Brookside, Corby, over in Homestead Mews and Green, in North Bennington, and now in Manchester.
Oh, wonderful.
We'll be collaborating with Manchester Health Services to provide programming there in their building and maybe some other public sites around there too. So what we do is we utilize there's a SASH coordinator, a full-time SASH coordinator for a panel, what's called a panel of enrollees, and there's a part-time wellness nurse. And what they do, we work to provide preventative health. We do preventative health stuff. We do service coordination. We do self-management around chronic disease, you know, working with folks around that. And one of the things that I think we do really well is transition support. So if someone is coming home from the ER or coming out of a rehab stay or nursing home stay, we're often the people that are there. There may be a delay, a little bit of a lag before healthcare services can get in there or other. So we can kind of relay that information to the other service providers that they're going to have. We can make sure that the medications that they need when they're coming home, they've got them all there.
Oh,
the preventative stuff that we do, the wellness nurse may, you know, if you have medication questions, you got a new medication and you have a question about that, they can answer that. They can take blood pressure. They can communicate with the doctor, with the physician, and or the nurse case manager about concerns that they have or concerns that you have. The programming that we do, the preventative programming, it's wellness programming. We do exercise programs in our hubs. We do nutritional, informational things. Right now we're doing a program called Expand Your Pantry, where our person brings a different fruit or vegetable or grain or something that you might not tend to know about, and prepares that and brings all of the nutritional information to the group.
That's
you know,
wonderful.
just to get folks to know more about, get them out of their rut a little bit. We do bone builders in some of the hubs. We do strengthening, home stretch exercises, things like that. And then we do something that's called a healthy living plan, which this is individualized. It's okay, you want to stay independent, you want to stay at home. What does that mean for you? How can you manage maybe your chronic condition or your lifestyle so that that's a reasonable goal, that you're going to be able to stay home, stay healthy, stay safe as long as possible. So we do a lot of different things. You know, we make sure that folks have access to the services that they need, whether it's public benefits or whether it's adult day or you know, maybe it's equipment that they need. So we steer them in the right direction to get the services that they need. We don't do it ourselves. We just, you know, kind of direct traffic to where they need to go, and then work with them pretty closely with accomplishing their own goals.
Oh, that's wonderful.
So.
That's wonderful. And how would you, in your course of coordination for one of your seniors in your case management, work with someone like BPI or the SHIP coordinator to better assist a senior in living independently in their home?
I can give you some real examples, but I may have someone that comes to me and their Medicare Part D isn't working for them. They have a medication that's not being covered by it, or they don't understand the paperwork. And initially I can do, you know, I can read the letters to them and explain a little bit, but then I call Sandy. And if there's a change in their, you know, if it's not working for them, I tell people that she has the magic computer. So she can put all of your information in there and she can tell you what's the best plan for you. So that's what we do there. And we do have folks that are enrolled in SASH that go to BPI. And so we can communicate with the folks at BPI if there's something that happens at home. We can let Amy know. I remember a very good one that happened when someone fell, and you know, you called me and I went up, and so because I was there, so I was able to get there, and everything worked out, and you sent another bus to come and get her, and off she went.
There we go.
Hardly a blip.
Oh, wonderful. Well, it sounds like seniors have a lot of support in their homes, in the community, to access healthcare resources available to them. If a senior was interested in becoming one of the SASH clients, how would they go about enrolling in that program?
Well, SASH is a Medicare-funded prevention program, so that means that folks need to be Medicare beneficiaries.
Okay.
Often they have turned 65, but it could also be that they're younger and receive Medicare. So you have to be receiving Medicare, because that's the funding stream, in order to enroll. And like I said before, we have hubs in Arlington, Bennington, North Bennington, and Manchester, but folks from Arlington and Shasberry are welcome as well to enroll. And the one thing, they could call us, they could email us. A person's primary care physician may have information about SASH, and either they or their nurse case manager or their nurse might be able to, they probably have a SASH brochure that they can give to you. The one thing I would say about folks is we tend to get referrals when people are starting to fail, when they're failing. And so they say, this person really needs some assistance. And I would say to folks that they should enroll in SASH before that, so that they can do some of the prevention stuff before they start the hospitalizations and the ER visits. And that way our wellness nurse also gets a baseline of, this is what you're like when you're healthy.
Yeah.
And then we're better able to see what the changes are when a person starts to fail. So I think a big benefit of SASH comes much earlier than people are are enrolling. So I would really suggest that folks enroll early.
Oh, that's wonderful. So, if you have questions about how to access your health care, how to access the adult day service, how to access SASH, you will find at the end of this video contact information for all of the agencies, as well as the Council on Aging Senior Helpline. And I encourage you to use that senior helpline if you have questions or concerns regarding your parts of your Medicare, A, B, C, or D. If you have any questions about, I want to stay at home, I don't want to go into a nursing home, or I'm living with my son or my daughter and I need to just get out for a few days of the week and I want to go to an adult day service program, or I'm just someone who lives at home alone and I happen to live in Corribee, Whitney, and I'm new to the area, and I wondered what SASH might do to help me out to maybe learn how to cook food at home or meals at home for myself, or maybe even help me get connected with the Meals on Wheels program here in Bennington. So you've got a lot of supports out there, seniors, and lots of avenues that you can access in order to maintain your independence here in southern Vermont.
Honey, what was it you saw Dr. Strangelove for on November 3rd?
Oh, that was to have him look at that spot on my neck.
Is that where I gave you that hickey?
Roger, don't be funny. Remember, I was worried about skin cancer.
So what'd he do?
He burned it off with that cold stuff. You know, it took about 2 weeks for the scab to disappear. Remember, I was looking all over the place for sweaters with high collars.
Yes. And that was all there was to it?
I think so. Why?
Well, do you have any idea of how much that cost?
No, why? It was covered by Medicare, wasn't it?
Yeah, most of it. But do you have any idea of how much that cost?
No. How much was it?
$30,789.
What?
$30,789.
That's ridiculous.
Yes, I agree. But considering some of the other charges Medicare got billed for, maybe it's not so ridiculous.
What other things?
The prostate exam. I didn't know you were having trouble with your prostate. That must explain why you spend so much time in the ladies' room.
What? What are you talking about?
Your prostate exam. It's right here on the bill.
What? Let me see that.
Oh, wait a minute. Here's another one. This'll really get you going. Let's see. Bilateral breast implants. Yes, that's the big one. That was over $30,000 by itself. Breast implants. I think you've been holding out on me, Beverly.
Roger, what in the world are you talking about? You know darn well I've never had breast implants. Never had a prostate exam. Let me see that.
Right there.
This is all wrong. There's some mistake here. Obviously, they've mixed me up with someone else. prostate exam. I'm going to call Dr. Strangelove's office and find out what this is all about. He's a dermatologist, for crying out loud. Why in the world would he be giving prostate exams or doing breast implants?
You haven't given out your Medicare number to anyone, have you, darling? You know, that's a common cause for Medicare fraud.
Well, of course not. Except when they called me a month ago and to tell me that my card had expired and they were going to send me a new one.
No. Your card had expired. Medicare cards don't expire. Did you give him your Medicare number when they called?
Well, sure. They said they needed it to process the new card.
I think we've been scammed. Dear, I think we better call Cove, that nice lady Anita, and report this right away. Somewhere around here, I've got a number to call. I picked it up at the senior center a couple weeks ago.
Oh, dear.
Oh, there it is.
I hope I didn't do something stupid. My stomach is starting to hurt.
Don't worry about it, honey. Tell you what, I might have left that number upstairs. Let's go up and look for it. While we're looking for it, you can tell me more about those breast implants.
Roger, you're a bad boy.
Oh, yeah.